Hi, I am Dr. Sidharth Verma. I am an intervention pain specialist and I treat patients who are suffering from chronic pain. Chronic pain, as you know, is any kind of pain which is more than 3 months of duration or 12 weeks of duration. I am often asked about back pain and its surgical treatment. Patients come to me who have been advised open surgery and they want to avoid it, and they ask me whether we can avoid it or not. So, yes, we can avoid the surgery almost in 90% of cases, but there are certain conditions where the surgery must be done, and these are medical emergencies like cauda equina syndrome or maybe some other conditions. However, in a majority of cases, we are able to prevent this surgery from happening. That is, patient will get relief without this surgery. So, if you have been advised any surgery for your back pain, which is you are very concerned that what will happen and you do not want to get operated. So, please seek an opinion of a pain management specialist. So, what the pain management consultant will do, he will just try to find out where the pain is coming from and treat you accordingly. So, our back is a structure which is made up of bones known as vertebrae and muscles, and there are small nerves which are coming out of this spinal cord. Okay. So, I will just show you a model. So, this is how the lower back looks like if we see the bony parts. Okay. So, this model shows the bony part of human lower back. So, if you see these are the small bones which are forming this back, and you can very well see here probably that this is this yellow portion, these are the nerves which are coming out of this spinal canal. Okay. And these nerves, if they are compressed, they lead to pain, and this pain may go to the distribution area of these nerves, which may be back, lower back, then your hips, your legs, calves and even toes, and this may also lead to symptoms like tingling, numbness and likewise. So, back pain has always been a puzzle for doctors, and to relieve patients from these symptoms, the doctors, they started dissecting and seeing why this pain is actually happening. And since the possible causes were compression of these nerves, so it was thought that if we somehow release that compression, then probably the pain will be relieved. So, surgery started happening, and the purpose of the surgery was to decompress, means to take pressure off these nerves and relieve the patient possibly from his or her pain. However, this surgery necessitated cutting and going through the back muscles and then reaching the bones and then retracting, and it itself caused so much of trauma that post the surgery the patient started having other symptoms as well. So, probably that level may be a little better, but maybe on the other side or maybe on one level up or one level down, the problem started happening. Similar things started happening with screws and fixations also, and therefore, the results, if we see the data, the results are not very encouraging. So, that is why probably the fear of surgery is there among patients, because they have seen their relatives or maybe their known people who are suffering from back pain, undergone some surgery and they recovered somewhat, but probably they either started with some other problem or probably the same problem started after n number of days or months or years or whatever. So, now non-surgical treatment, there are variety of options which are available now, and your intervention pain physician or the pain specialist can guide you, and he can provide you with all these advanced options which are minimally invasive, means they cause minimum damage to your body, to your the back and the muscles, because they do not involve any cutting or any suturing or any general anesthesia. So, it is a very advanced procedure which will lead to good pain relief in majority of patients. However, the indications are very clear cut, and we cannot do these procedures in each and every patient. So, it is better if you consult an intervention pain physician. He can see, evaluate and tell you that whether you will be suited for this procedure or not. To name these procedures, they can be as simple as a simple epidural injection in which we inject a local steroid. So, as soon as I say the word steroid, people may start thinking that it will be harmful for the body, but it will not be the case, because this is a very small dose of the steroid which is delivered directly at near the nerve root, so that the inflammation subsides, and this results in relief from the pain. Also, the another method is to decompress the nerve with the help of percutaneous procedures. Percutaneous means the patient is awake under local anesthesia. These all procedures are done. We reach the spinal the intervertebral disc space with the help of a needle, and then we can take it out, take the disc out from that portion, and we can, with the help of a radio frequency current, we can seal the region actually, and this will result in decompression of the nerve and relief from the symptom. Okay. So, however, the indications are very clear cut, and as I mentioned, you will need to go to your intervention pain physician, who will see whether you are suitable for those procedures, and he will suggest and guide you for these procedures. Another important thing which is common is post surgery pain. So, if you have undergone any back surgery and you are still having pain, then you must visit your intervention pain physician. You must go to him, get yourself checked, and try and find out the possible cause of that pain. It may also be possible that before surgery you had a different kind of pain, after surgery you have a different kind of pain. So, your pain physician will often be able to diagnose and give a diagnostic procedure if required, or maybe give you a curative or maybe palliative procedure as and what required. So, this was about back pain. For more information, you can visit my Lybrate website on www.lybrate.com/doctor/Sidharth Verma, Sidharth Verma.